Osteoarthritis is the most common form of arthritis, can damage any joint. The disorder most commonly affects joints in your hands, knees, hips, and spine. The diagnosis can come through X-rays. X-rays, they are not like they don't show cartilage on the image, but cartilage loss is revealed by narrowing of the space between the bones in your jaw. An X-ray can also show bone spurs around a joint. We can also perform magnetic resonance imaging. An MRI uses radio waves and a strong magnetic field to produce detailed images of the bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose this type of disease, but it can help provide more information in complex cases. We can also perform some bloody tests. Although there is no bloody test to test the disease, but there's some certain tests that can help rule out other causes of the joint pain, such as rheumatoid arthritis. Also, we can perform joint fluid analysis, so the doctor might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether your pain is caused by gut or an infection rather than the disease.
Okay, so there are some medications that don't cure hip osteoarthritis, but they can help with the pain. Acetaminophen has been shown to help some people with osteoarthritis who have mild to moderate pain. However, taking more than the recommended dose of acetaminophen can cause liver damage. Non-steroidal anti-inflammatory drugs, or NSAIDs, there are some of them that are over the counter, such as ibuprofen, naproxen, sodium, and if they are taken at the recommended dose, they typically relieve osteoarthritis pain. There is also stronger NSAIDs that are available by prescription. NSAIDs can cause stomach upset, cardiovascular problems, bleeding problems, and liver and kidney damage. NSAIDs as gel are also available, and they are applied to the skin over the affected joint, and they have fewer side effects and may relieve the pain just as well. Moreover, duloxetine drugs are normally used as antidepressants, but this medication has also been approved to treat chronic pain as well, including osteoarthritis pain. Physical therapy is another kind of therapy that people with osteoarthritis pain can use. A physical therapist can show the patient exercises to strengthen the muscles around the joint, increase the flexibility, and reduce the pain. Regular gentle exercises that the patient can do on their own, such as swimming or walking, can be equally effective. Occupational therapy can change the activity, environments, or skills in a patient in order to relieve pain. For instance, a toothbrush with a larger grip could make brushing the teeth easier if someone has arthritis in their hand. Manual therapy, ice and heat therapies, home exercises, and ultrasound therapy are some of the occupational therapies for people with hip or knee osteoarthritis. Transcutaneous electrical nerve stimulation is using a low voltage electrical current to relieve pain. It provides short-term relief for some people with knee and hip cortisone injections are injection of a corticosteroid into the joint that might relieve pain for a few weeks. The doctor numbs the area around the joint, then places a needle into the space within your joint and injects medication. The number of cortisone injections that someone can receive each year is generally limited to 3 or 4 because the medication can worsen joint damage over the time. Lubrication injections. Injection of hyaluronic acid might relieve pain but by providing some cushioning in the knee. Though some research suggests that these injections offer no more relief than a placebo. Hyaluronic acid is similar to a component normally found in the joint's fluid. Relining bones. If osteoarthritis has damaged one side of the knee more than the other, an osteotomy might be helpful. In a knee osteotomy, a surgeon cuts across a bone either above or below the knee and then removes or adds wedges of bone. This shifts the body weight away from the worn out parts of the knee. There is also joint replacement that in this method, uh, the, repla- um, the replacement surgery, the surgeon removes a damaged joint surface and replace it with plastic and metal parts. Surgical risks include infection and blood clots. Artificial joints can wear out or come loose and might eventually need to be replaced.
Hi, my name is Julia, and I'll be presenting the parts of the hip replacement. So the procedure for replacing the natural hip basically consists of the femoral component, the acrotibial component, which is in the pelvis, and the spherical head. There are several different types of prosthesis in terms of size, model, concept, means of fixation to the bone, and contact surfaces. Next slide. The components that can be replaced are either partial or total. The partial replacement usually it only consists of the femoral component being replaced. However, the total replacement is the femoral and the acrotibial component being replaced. This can be divided into different forms of fixation to the bone. There is a cemented, when the components of the femur and the acrotibium are fixed in the bone by orthopedic cement. There's uncemented, where the components of the femur and the acrotibium are fixed into the bone by pressure. And then there's the hybrid, which is a combination of the two, where one part is fixed under pressure, usually the acrotibium, and the other is fixated with cementation, which is typically the femur. The prosthesis have several different types of combinations with the head and the acrotibium. These combinations can either be metal and polyethylene, ceramic and polyethylene, ceramic and ceramic, metal and metal, or ceramic and metal.